Okay. Hi. Hi, everyone. Sorry for the little delay. We were just getting everything set up. Technology can be troublesome sometimes, but I'm so grateful to everyone who's here today, and especially to Priyanka and Simmone, who are lending their expert voices to this topic that really deserves more attention than it gets. Um, if you have ever suffered from chronic vaginal infections, pregnancy, not suffered from pregnancy, but experienced pregnancy, gone through postpartum, or had a loss around pregnancy, you know how taxing, like secretly taxing these things and experiences can be on your emotional well-being. And I just want to say that you're not alone. Almost 75% of users report that vaginal infections negatively affect their quality of life at a rating of 6 out of 10, 10 being the worst. So this is like a big deal. It's something that's really important, and I'm so excited to talk about it. We're here to really destigmatize this topic, offer you support, answer questions, and just I'm Amelia. I work for Evvy, but I want to let Priyanka and Simmone talk and share their wisdom. So let's start with introductions. Simmone, will you tell us a little bit about yourself and poppy seed health for people who aren't familiar? And then Priyanka, I'll have you talk about Evvy and yourself.
Sure. I am so excited to be in conversation with Evvy today and with you, Priyanka. I'm Simmone Taitt. I'm the founder and CEO of Poppy Seed Health. We deliver emotional and mental health support on demand, all via text message. And we do that in 90 seconds or less with our amazing network of advocates across the country. So our doulas, midwives, and nurses. And it's something that we think is so incredibly important with loss, pregnancy, and postpartum, but truly across the entire reproductive healthcare spectrum for wherever you are in your journey. And we know that being grounded in mental health and emotional health support and having that access is so important. And you use the word secret, Amelia, and like going through a lot of our journeys and the things that come along with it. So we're going to have a great conversation today, and I'm looking forward to that.
Yes, and I'm Priyanka. I'm so excited that we are finally doing something together, Simmone. It's been a long time coming. I'm a longtime fan of Simmone, her amazing platform, and also what she's specifically building at Poppy Seed. And I'm Priyanka. I'm the co-founder and CEO of Evvy. At Evvy, I'm sure everyone here knows already, but I will give a brief introduction. At Evvy, we're really focused on making sure that the female body isn't a medical mystery. First, for women and people with vaginas, right? So how can we educate people about their own bodies in a scientific, smart way so that you have the information to best advocate for yourself in whatever system you're doing that? And on the back end, can we finally collect the data to enable better tools, outcomes, diagnostics, therapeutics, so that women's health is not as far behind as unfortunately it is today? And as everyone here probably knows, so many of the reasons that we have these mental health, negative experiences going through so many of these women's health challenges is because there's so little research, right? And so the tools that we have access to end up not being effective, which is then really upsetting, right? And I think just the realization for me, at least, that women weren't in clinical research until 1993 made me feel like, oh, my whole life makes sense. And I think hopefully that's reassuring to many of you. So obviously, very excited to be here and talk about this problem. I think Simmone and I can both relate deeply to the ways that your mental health is affected by a lack of understanding of female health. And we're excited today to focus on this topic.
Absolutely. And just want to thank both of you for creating these incredible organizations. Like, I feel so much more taken care of as a person with a vagina that I now have options, thanks to people like you who are really listening and doing the work that did not exist before. I also just want to encourage everyone who's watching live today to please post any questions you have. We'll try and get to all of them, but we do have a little bit of time at the end for a Q&A, so you can just write them in the chat box and we'll get to them towards the end of the webinar. Okay, so let's talk about this relationship between vaginal health and mental health. Priyanka, I want to start with you. what do you think are, or what do you see like the most common ways that vaginal health, whether it's symptoms or recurrent infections, affects people's mental health in the Evvy community?
Yeah, absolutely. I mean, we always say at Evvy that vaginal health is mental health. You can't separate those two things. I think when you first experience a vaginal infection, it can be scary. It can be, shameful. There are a lot of emotions that people feel around it. And then I think as so many of us experience these infections recurrently, I think it can be incredibly frustrating, right? It's frustrating that there aren't better answers. It's frustrating that there aren't better treatments or better tools for us. Obviously, we're trying to change that at Evvy, but I think along the way, there's so much that is frustrating about the experience, right? And then you think about the experiences that you have relationally around vaginal health, right? Whether that's with your partner, it's with your doctor, all of those experiences can just add more to what's already a frustrating, shameful, isolating experience. And I think that, as Amelia mentioned at the beginning, within the Evvy community, 75% of people are saying that their vaginal health is affecting their quality of life, right? So I think the first thing we can do is acknowledge that we're not alone in that, and that there is such a big overlap between vaginal health and mental health, and hopefully providing safe spaces like this, as well as communities of peers, can help us change that for the long term. But they definitely are related.
Thank you so much. I was just copying a question over. Simmone, Poppy Seed Health focuses a lot on emotional support. You have this incredible like instant chat, which I think is amazing. I think we've all been there when we have like something going on and we're like, wait, I need to talk to someone right now, please. But it's related generally to pregnancy and the pregnancy journey around postpartum and loss. Can you talk a little bit about the common ways that you see pregnancy-related mental health challenges affecting people throughout their journey?
Oh, sure. I mean, there's such a plethora of emotional and mental health challenges and obstacles. So the very first is that we are the only developed country where maternal mental health is not a part of our journey at all. So once you start onto your trying to conceive journey and then you actually get pregnant, you are asked one time typically, and that is after you have the baby, how you're feeling. Once you're asked that, it's a part of a survey, which sometimes they don't even tell you. And you better not red flag on that survey, because if you do, one of two things are going to happen. The first is that you're most likely going to get looked at and say, and they're going to say, you're just hormonal, you had a baby, you'll feel better tomorrow, go home. Or the second thing is that you do red flag, and unfortunately, Child Protective Services gets involved. So I just make this example because it's fact, right? It's true in the US. And what we know is so important to change is accessibility and that acute need for people when they have emotional and mental health issues that are coming up on their journey, which, by the way, it could be as simple as you've just gotten pregnant, you just found out, and no one else knows. 50% of all pregnancies in the US are unplanned. That could be your first pregnancy or your fifth, it doesn't matter. And so having somewhere to go is really important. And at Poppy, we do a lot of surveys. We realize that one of the number one reasons people come to us is our expediency, right? So Amelia, you said, on demand, it's very quick. So publicly, we say within 90 seconds, someone will pick up your chat, but our actual latency is just under 10 seconds. And that's because people who are experiencing pregnancy, postpartum, or loss, or thinking about making their own bodily choices for things like abortion, or, this discharge that is coming out of my, vagina all of a sudden, those crucial seconds to connect with someone is so, so important. And we lead with emotional and mental health support because we know that if we can establish trust and empathy very quickly, that is actually the pathway and the gateway to helping someone and setting them up to self-advocate for the things that they need.
I mean, I have never heard that about the mental health, maternal mental health not being part of the journey in the US. That's disturbing to say the least. And I think some of the things that you were saying kind of leads me to my next question. These are both very stigmatized spaces, right? That people have like really felt the need to suffer in silence in for so long. What do you think are the most unique challenges that come out of this intersection between spaces that are not always talked about publicly, or people don't feel comfortable sharing with their family or even their doctor? Either one of you can jump in. Please go ahead.
I can go first. Oh, actually, there is someone revving their engine outside my apartment in New York. So actually, Simmone, why don't you go first?
I know this is real time, people. This is live, right? We do this live, especially in New York City. I'm shocked it's just someone revving their engine. So I'm sorry, Amelia. Can you say the question one more time?
Of course. I was just saying that these are such unique spaces. Like there's been so much stigma around both of them, and people, in the mental health who are suffering with strictly mental health, who are suffering with strictly vaginal health, have just been sitting in silence for so long. And then you get this intersection, right? That's really intense. And so I'm wondering if you can just both speak to the unique challenges that you think come out of these two really stigmatized spaces.
Right. So, I know for Evvy and Priyanka, we share something in common, and that is we support people with vaginas, period. And so we already know historically that there's so much shame around being a vagina owner in some ways. I'm constantly thinking, and I really do mean this, constantly thinking about my own body parts that include a vagina and how I'm caring for mine. So then I think about 50% of the population that are also vagina holders that are thinking about theirs, or at least getting the things and needing the things that we don't often talk about, or that are stigmatized or shameful. One of the things, and I'll loop back here because I think it's important. We don't have doctors or psychiatrists or therapists who are answering your chats at Poppy. We have doulas, midwives, and nurses. They are specifically trained as patient advocates, right? Like they are already in our infrastructure, and they are specifically trained to listen to the emotional needs of people. And so with vaginal, anything to do with the vagina, whether that is your, joy, challenges, pain, whatever it is with mental health, I will tell you one of the very first things that we typically hear from people is, I'm so ashamed to say I have another yeast infection, which is very common, by the way, as your body hormonally changes as you go through pregnancy. Or, we really do get discharge questions a lot. And those discharge questions are, on the spectrum, but it's also, I had nowhere to go to talk about this, or I don't want to end up in my doctor's office again, after I've had my, 10th UTI. I don't want them to think that I'm dirty. Like there's just like culturally speaking, all of the negative narrative around being a vagina holder, and then also the kind of care that we're getting on the other end. So not only is there a really close correlation with your emotional and mental health state, but I think we're very much trying to, between Poppy and Evvy, break that narrative and completely introduce a brand new narrative, that ownership is a proud moment and that there are solutions that can help you.
Of course. And you are so not alone. Like Priyanka, you can speak to this, but people get recurrent infections are our bread and butter. Like I'll let you speak, but
yeah, no, I think everything you just said was so beautifully said, Simmone. I truly had to change rooms because the revving engine was not ending. So I apologize that I'm now on the floor of a closet, but that's what living in New York will do to you.
Okay.
But no, I completely agree with what you're saying. I think one of the very unique challenges that come with this component of healthcare intersecting with mental health care is the amount of shame and stigma that we feel about this, right? I think there's so many people that when they're diagnosed with BV or bacterial vaginosis, which is the most common vaginal infection, feel this huge amount of shame or worry that it's not clean or that they feel dirty or whatever it is. And I think so much of that is because we don't talk about vaginal odor. We don't realize that 30% of people with vaginas at any given time are experiencing that condition, right? And because we don't talk about it, not only are we dealing with the physical manifestations of these healthcare conditions, we're also dealing with isolation and shame and all of these things that are so unnecessary and are not actually required components of dealing with these healthcare conditions. But because of the way that our society has treated people with vaginas, or specifically vaginal health conditions, we're taught to think that, this is shameful, right? And I think that having conversations, being willing to go out there and say, I've had vaginal infections, we've all been there, is a big start. Having access to peer communities, having access to amazing doulas and experts like what Poppy offers is so important. And starting to break that down, right? Because in the same way that there are, physical challenges with so many different healthcare conditions, like we don't need to add to the burden of being a vagina holder with all of the additional shame, right? Like we already have it hard enough in the healthcare system that barely understands bodies like ours, that it's our job to start to advocate for ourselves, right? And it's amazing that Simmone and I can stand here as two female founders of color who run companies focused on vagina owners, right? Like there is something changing in the water, but it really requires our patients to say that they care about things like this, right? Because I'm sure you have many of the same stories, Simmone, of fundraising and investors telling us, I don't know if this is really a problem, or do people really care about this? And I think that, all of us raising our voices and saying that this does matter, this does affect our lives, is how we get the funding into tools like Evvy and Poppy Seed that actually do create change.
Well, my favorite is, this seems very niche. Niche when 50% of the population are
I
born
get that one all the time.
with a vagina.
Vaginal infections.
Oh, so niche.
Yeah.
Literally the opposite of niche. It's like, it could not be
vaginal
more.
Infections are mainstream.
Mainstream.
Yeah.
We need t-shirts that say that. My BV is mainstream.
Yeah.
So speaking of just, kind of like finding ways to get support, I feel like with Poppy Seed, Simmone, you live this every day. Like you are really offering, and I think Evvy too, with our coaching, patients just getting the chance to talk to someone about their Evvy results. But I'm curious if you have any kind of pillars or strategies and tools that people can actually use as they're experiencing things like anxiety, depression, grief, stress as a result of this condition. Like what in a day-to-day can someone do to try and really feel better when they're struggling?
Mm-hmm. So we have 3 pillars at Poppy Seed Health, and I have to say that they are applicable to everyday life for people too. And the acronym is SEA, like the deep blue sea, SEA. The first is support, right? You want to find yourself support. And we think about support across a full spectrum of your entire care. We don't just think about it as it relates to your emotional mental health support. That's what we're very good at. But the best outcomes for us will always be the support that we have holistically. That's with your provider. It's with a medical professional of some sort that you really trust and know. And it's with your emotional and mental health support. And it's also with your community. And with community, that means different things to different people. So you can be a part of the Evvy community, right? You can be a part of a community where, let's say you're not participating, but there's just so much support there and you just don't know how to yet. But the point is that that's the support. The next pillar is education. Now, I cannot stress this enough, and that is that evidence-based education is the kind of information that we need to not only empower ourselves, but each other. And I really believe in never sitting on good education and good information. Everyone is unique. We are unique like snowflakes. Everyone is very different, but there are patterns there that we can use for ourselves and also share with other people. I think education is one of the things that I'm really passionate about in changing and people having access to. And then the third pillar is advocacy, because when you have the support and then you have the education, you are able to self-advocate in ways that not only help to have you have better health outcomes, to be seen and to be heard, oftentimes when you are ignored, but it also actually helps for the person who's coming after you, right? We really want to change the way that we think about advocacy and self-advocacy. There's never been a more important time, especially in women's and reproductive health, where we're at this unique inflection point between the consumer or the patient, so me and you, being able to advocate for ourselves and participate in our own care, because we have tools like Poppy and Evvy. But my big buzzword for sure, which I hope becomes a part of reality, is participatory care. Participate in your care. It should be a really exciting time for you to be able to do that.
I love that so much. We always say at Evvy, what does it look like to enable shared decision-making at the doctor's office, right? When you only have 15 minutes with a doctor, then frankly, there just isn't enough time for the doctor to do an exam, figure out what's going on, educate you about what that means, what all of the options are, and get to the right decision. So what often ends up happening is that the whole middle part gets skipped, right? They do the exam, they come up with the diagnosis, and then they decide on the treatment and they tell you. And then you leave the doctor's office and you realize you have 100 questions and you don't know where to go. And you don't know if they're 100% right because they didn't hear this piece of your background. And that's where I think that tools like Poppy and Evvy are so helpful, right? How can you get better data on your body in advance? How can you make sure that you really understand how to describe your symptoms? You've documented your journey so that when you go into the doctor's office, you can go in with the right level of information to participate in the conversation. I love that term that you came up with, because I think it's about time that especially women have a chance to advocate for themselves at the doctor's office. It's just, I think there's so much research showing that women are far more likely to feel dismissed or ignored or misdiagnosed than men are. And I think that tools like Poppy and Evvy will hopefully change that.
Absolutely. And, we have one of our amazing advisors said, keep a journal, keep a discharge journal, keep a very thorough record of everything is going, because we've all been there where we think we're going into the doctor's office. We're so excited. We finally got our appointment and we're like, we can't wait to tell them everything. And then the minute you're sitting on the table, you're like, wait, when did I have that? What did I do first? Who did I have sex with? And so I think that is such an important part when you come, whoever you're talking to, whether it's your midwife or a healthcare provider, you have your, the detailed results of what's happening in your vaginal microbiome, and your journal, and you can say, I think that this, condom is really irritating me, or I think this laundry detergent is affecting my symptoms and I'm having pain. And it's just so important to have the education to do that, and the tools. Mm-hmm. So Simmone, I want to ask you a little bit about, how to talk to providers. I think it's really easy to say, just communicate with your provider. But what are tools that people can use to have their provider really understand how much these challenges can that are affecting their mental health, and have them really take you seriously and give help throughout the process?
Yeah, I love this question, because I think having tools and knowing really simple things when maybe a million things are going through your mind, especially if you're going for a diagnosis, which I want to say that I commend Evvy, right? Because sometimes finding out about something by yourself or with a loved one in the comfort of your own home is actually the best place to find out. So that by the time you get to your doctor's office, you're able to have a conversation that may not be deeply emotional or something that you haven't even had time to absorb. But if you should be in that position, I like to suggest leading with I feel statements and then the outcome. So for example, it would be something like, I feel really uncomfortable when I'm sitting down because of this yeast infection, and therefore I don't want to go to work, and I need to be able to provide for my family, or I don't have more sick days, right? Typically, when you're able to express the way that you're feeling about something and how it's affecting you physically, and then the outcome of that it makes it easier. Some things are more universal, right? If you're talking to someone who also needs to provide for their family, they will understand that. Like, let's get to a resolve as soon as possible. Another great example is something like, I feel judged when I'm calling out of work because I'm so nauseous in this first trimester, I can't get out of bed. And I'm afraid that my boss thinks I'm incompetent or that I'm going to lose my job, right? There is this is how I'm feeling emotionally. This is what's happening as the outcome. And so hopefully the provider then says, okay, well, let's try everything we possibly can to fix this nausea. Or let me write you a note that says, this is why you're actually missing work, whatever it is. But the I feel statements, this is, what it's making me feel like, right? This is the outcome. And it's causing this effect.
I love that. That is such a powerful tool, and it's simple too, which makes it easy to remember. So thank you.
Sure.
I want to move on to the kind of other hot topic here, and then we'll go into audience questions, which is communicating with your partner. All of these things can put such an emotional strain and burden on your intimate relationships. Priyanka, do you have any helpful strategies for talking to your partner, whether it's long-term or short-term, about what you're going through and building empathy for what you're dealing with?
Yeah, absolutely. It's such an important question and something that we get asked all the time at Evvy. And that is, it feels so difficult until you kind of break it down into the individual components, right? And I actually think Amelia's amazing team at Evvy that owns all of our content and education, they have a really great article on this that I encourage everyone to read, but I will give you the spark notes for now, which is first thinking about, if you have an intimate partner, real intimacy is actually sharing, right? Is being vulnerable, right? And if you can trust someone with this type of information, that is real intimacy that will lead to stronger physical intimacy or a stronger relationship in other parts of your life, right? So instead of thinking about it like this is a big damper on our sex life, how can you think about it as this is actually a way for us to be closer. This is a way for us to be more vulnerable with each other and really understand where we're coming from. And that can unlock so many things, right? About what's pleasurable to you? What do you really want in sex anyways? And so, just thinking about the fact that having the conversation itself is actually an opportunity to strengthen your relationship. I also think that, it's important to talk about it generally. The second thing we always say is like, you have to advocate for yourself. Instead of saying, I'm tired or I'm just not feeling well, when really where it's coming from is that you have an infection or it causes you pain or discomfort. It's important to say that, right? Because it enables your partner to really understand where you're coming from and empathize with you in this journey that can be so frustrating, right? And you're helping the next person, right? You're contributing to changing the taboos and the stigma that we've all been talking about today. And then the last couple of things we always say are, it's not about pointing fingers, even if, oftentimes people feel like their infections are triggered after sexual experiences. It's also important to remember that it's no one individual's fault. You know what the fault is? It's the fault that we haven't invested in more research to understand the role of sex and vaginal infections, right? But it's no one specific's fault. So making sure that you don't approach the conversation in an accusing fashion can help everyone understand that they have a shared responsibility in getting out of this, right? And then I also think it's a nice way to teach someone something, right? It's an opportunity to ask, do you have questions? Do you understand this? Do you want to talk about this more, right? Because at the end of the day, unfortunately, none of us were taught any of this in sex ed, even though we all should have been taught a lot more about our vaginas and our health, right? And so our hope is that by thinking about the role of your partner, you can actually not only deepen your relationships and make those more pleasurable, more honest, more intimate, but also we can start actually educating the world so that that person can educate their friends or their kids. And eventually that's how we change things.
Yeah. And I'll just add on to that and say, you never have to say that you're sorry for something that you're dealing with health-wise. Like, it's a body. You wouldn't say, sorry, I broke my leg. You know, you don't need to say, sorry, I have a yeast infection, or I'm sorry, I'm feeling really nauseous, or I have horrible cramps. Like, this is your body. And at the end of the day, it's your job to take care of yourself and to prioritize yourself in your relationship. And just because something is wrong doesn't mean that you need to apologize to your partner. And I know that's easier said
love
than
that.
done, but know that you have a whole team of people here on this webinar who are supporting you in that, and will continue to support you. And I know that's Poppy Seed and Evvy both have amazing communities that, you know, will continuously provide that support as well. We had an audience question come in for you, Simmone. Does Poppy anticipate opening up specific services to people who are suffering from vaginal pain?
Poppy anticipates creating paths and funnels for all the inflection points that actually affect people with vaginas. That also includes vaginal pain. I know that sounds like a very non-direct answer, but let me say this. So many times, and just so you know, Poppy has been around for 2 years. We've just had our 2-year birthday a couple of weeks ago. But what we've learned in the nearly 4 million minutes of chat time, which is about 60,000 hours of people talking to us about their feelings, is that we truly are the frontliners on feelings. And so because of that, though someone might come to us for things like nausea, or one of our favorite, lightning crotch, which does happen when you're second semester pregnant and your uterus is growing right over your pelvic bones. And so it creates some really discomfort, shock to your groin. We'll go from those conversations to, and my vagina feels like this, or these are the things that are going on with my vagina. So though people may not be coming directly for those questions, we tumbleweed into them. And we're really proud of that, because not only does that mean that we've established trust with folks, but it means that we've now collected enough information and data points to tell us what people actually want to talk about. And like, shocking, they want to talk about their vaginas in ways that we can help them for wherever they are in their journey. So will we introduce something very like specifically for vaginal pain, which there are like multiple diagnoses just for vaginal pain. I can't say that we will exactly do that, but I can tell you that what we are so invested in is getting you to the place where you can actually either figure out what's going on, or we are absolutely able to emotionally and mentally, you know, support you on that journey of whatever that looks like. We will say with vaginal pain, like so many other things that go unnoticed, undiagnosed, or we're just suffering in silence, we're very good at just listening and talking you through it.
I think we need a vaginal discharge hotline. I think everyone's
100%.
looking for the hotline of.
We'll co-opt that with you.
We do. I will run it happily.
Yeah.
Priyanka, this is a question, it was answered in the chat, but I think it's a great question. If you don't have any symptoms and are cycling naturally, when in your cycle is it best to use Evvy to gain general information about your vaginal microbiome and health?
Yeah, such a good question. We always say you should take an Evvy test whenever you're trying to answer a specific question, right? So if you are curious how a certain behavior influences your vaginal microbiome, then after that behavior is a good time to take a test. Or, but if you're just generally curious about your vaginal health, I would say anytime that you're not on your period, obviously, is a good time. And if you want to take, multiple tests over different months to kind of see how it's changing over time, I feel like an easy time to do it, or to remember to do it, is kind of like the midpoint of your cycle. So you're not about to get your period, you're not, might still have spotting going on. So I feel like the midpoint of your cycle is like an easy time to remember that can help you kind of track over time.
Yeah. And I think we have so many people who test like before a treatment, after a treatment, or just generally like maintenance, kind of like what Priyanka was talking about. And it's really interesting. Like I personally love seeing my testing over time, like, what the percentage of my lactobacilli is this month versus the Gardnerella here. It's really interesting to like be that in touch with your body and have that knowledge is power.
Right. Or even realizing like, okay, I have a little bit of discomfort and I took a test and now I know that I had a little bit of disruptive bacteria, but I don't need to panic because I also know that like I cycle through this, right? Like now I've done this test 3 times. I've seen this happen and I know it doesn't turn into infection versus when you have the data around your symptoms and then you do know what's an infection, right? And then okay, now is the time I need to go to the doctor versus now is the time that I know I'm going to feel fine in a week. And so I definitely think that making sure that you test at the times that give you the information that you're looking for. Like we just hope that Evvy is a tool to give you answers in a place that has lacked answers for too long.
We had a question come in through our Facebook group that I think I would love to answer. And if you guys want to jump in, I think please do. But this was kind of related to what we were talking about a little bit earlier, which is how do you keep these issues from ruining your relationship? I think that's an experience that a lot of people have. And I'll just start off by saying, we are close with a lot of like sexual health therapists who talk a lot about that. Intimacy is not always just like sexual, and you can build intimacy even when you're not having sex, through lots of different ways of, engaging with each other's bodies, but you don't necessarily need to be having sex. And so there are some great like sex health therapists on Instagram that you can follow. I'm happy to share out some names after the webinar. But that can be a really great resource because you have chronic infections or because you're dealing with pain, you can't actually have a sexually intimate relationship with your partner. I don't know if Priyanka or Simmone, you want to add anything else?
Sure. Is it tell a personal story time? I wasn't planning on it, but I think this is probably a good place because I think that oh goodness, especially in partner relationships, it can get really difficult, especially if you're just dating, especially if things aren't happening when you've been with a longtime partner and all of a sudden you have a diagnosis. So I'll share a very quick personal story, and that is I have always suffered from very heavy periods. And then I met my current partner, and we were early days of dating, and I was just avoiding dates, and it was for 6 days at a time. And finally, my partner was like, what is going on? Like, what's happening? And for the first time in over 35 years of my life, I was like, okay, this is what's happening. I really like you. I'm afraid that this is going to be a problem. It's like a crime scene when I have my periods, and it's very painful. And he looked at me and he was like, well, I don't want you in pain. And that is what I think intimacy and vulnerability and being able to speak your truth does for you. All the other times I was like, this is such an inconvenience. And also I have to plan my whole life. But actually it was about finding the right partner, right? The right partner to say, I don't want you in pain. Let's actually figure out what's going on. Whereas I was just focused on all of the blood that was coming out of me. He was focused on, I don't want you in pain. And so I think that really does hopefully set whoever is listening to us out there up for how powerful honesty and vulnerability and building on intimacy that's not just physical, how much of a game changer that could possibly be for you in the communication on behalf of your girl downstairs with your partner.
Oh, that's so nice of you to share. And I think everyone can relate to some version of that story, right? You can tell when you share something and it's met in a way that's above what you could have even dreamed, right? It's the best feeling when you're like, wow, you responded so well to that. Now I want to tell you everything, right? And to feel shut down, to feel ashamed, like those aren't ways that you should feel, right? And I think that in the same way that we've been conditioned to feel shameful or to be scared, I also think that a lot of our partners have been conditioned to think this is gross or to have certain responses, right? And I think giving them the space to have their initial reaction and then expecting better, right? And then saying, okay, but now I'm going to educate you about this, and then I'm going to hold you to a higher standard, right? And I think it's a lot easier said than done. We'll start with that. But I also think everyone deserves a partner who responds the way that your partner did, Simmone. And I think it's a great bar to set for ourselves.
Mm-hmm.
Absolutely. And thank you so much for sharing that story, Simmone. I really appreciate you being so open. We are at time, so I just want to thank everyone who tuned in today. And Priyanka and Simmone, you guys, I look up to you so much. I think everyone who registered for this webinar and who tuned into this webinar is just so grateful for the amazing things that you are doing on behalf of all people with vaginas. Like, we are making huge strides in healthcare because of what you're building. So seriously, thank you. We will send a recording out via email as soon as it's ready. And if you want to keep in touch with Evvy and Poppy Seed Health, you can follow us on Instagram at Evvy and at Poppy Seed Health. So thank you so much. You guys rock.
Thank you, Amelia, for the amazing educational platform that you are building. And thank you so much, Simmone, for joining us and for all of the amazing work you're doing at Poppy Seed. We are so lucky to be partners with you. And I think that some type of collaboration around a vaginal discharge hotline might have to be in our future.
100%. Thanks for having me.
Thank you all so much.
Bye.
Bye.